Assalamu alaikum everyone, welcome back to another ATP video. So today we'll be talking about Mycobacterium tuberculosis, or as it's commonly referred to as TB. It will be a short, concise video, but we will cover the most important details you need to know about. Now before we start, I would like to briefly talk about Mycobacteria itself. It's called Mycobacteria because it contains a unique substance in its cell wall called mycolic acid. Mycolic acid contains lipids, making the cell wall of the bacteria a lipid-rich cell wall. Mycobacteria are also called acid-fast. This is because they are resistant to decolorization by acid after staining with carbofucsin. Therefore, they gram stain poorly. So, what do we use to stain them then? We use something called Zeal-Nielsen stain. This stain is used to detect mycobacteria, especially TB. Out of all Mycobacterium species, namely Mycobacterium avium complex, Kansasii, lepri, and tuberculosis, TB is the most important one and the one we will be discussing today. The name tuberculosis comes from the word tubercle, which means round nodule. Therefore, tuberculosis means multiple round nodules. Now let's talk about the features of TB. First of all, it's an obligate aerobic bacillus, which means it requires oxygen to grow. And that is why it makes sense for TB to prefer going to the lungs. Primary infection usually occurs in the lower or middle lobes of the lungs, while reactivated TB prefers the upper lobes, as it has a high VQ ratio. V stands for ventilation and Q stands for perfusion. This means there's a lot of extra O2 and ventilation present, and that is perfect for bugs like TB. Secondly, it's a facultative intracellular organism. This means they can live inside other cells when they need to. And one thing you need to always remember is that TB infects macrophages. Now it's time for our flash quiz. So, if a question is talking about the Zeal-Nielsen stain, then what you should be thinking about? I'll give you a few seconds to think about it. Yes, it's TB. This is a very high yield concept, so please keep it in mind. TB has multiple virulence factors, so let's talk about a few of them now. The first one is trehalose dimycolate, also known as cord factor. This helps TB evade immune response. It has also been shown to cause granuloma formation and trigger cytokine release. Then we have sulfatides, which are glycolipids on the surface of mycobacteria, and they prevent phagocyte activation and phagosome-lysosome fusion. This allows for the survival of the mycobacteria inside of cells. Lastly, catalase peroxidase. This is an enzyme which allows TB to be resistant to host cell oxidation. TB is transmitted through inhalation, and that is how it gains access to your lungs. Most patients do not develop an active TB infection. Usually it either clears up or remains latent. Now for the clinical importance. TB gets into the alveoli, where macrophages phagocytose them. Usually, with most pathogens, macrophages would package them in phagosomes and fuse them with lysosomes, which would break it down, but that is not possible because of its various virulence factors. So, what happens instead is that TB starts to grow inside the macrophage. Eventually, it will kill the macrophage and it will spill TB into the lung. Few weeks later, the cell-mediated immunity kicks in, which is a Th1 response. CD4 T cells get activated and release of interferon gamma happens. Macrophages and cytotoxic T lymphocytes also get activated. Something else you must keep in mind is that this is a type 4 hypersensitivity reaction. All of this leads to formation of a granuloma, which essentially is an attempt of the immunity system to wall off the bacteria and prevent it from spreading. The tissue in the middle dies, leading to something called a caseating necrosis, or cheese-like necrosis. This is pretty disgusting. This area is known as the Gone focus. These are usually subpleural and can be found in the mid to lower lobes of the lungs. TB can reach the nearby hilar lymph nodes as well, and cause caseating necrosis there. So, the association of the lymph node with the caseating tissue is known as Gone complex. The Gone complex can undergo fibrosis and calcification, and often produce a scar tissue. This calcified Gone complex is known as Ranke complex. Now, there are two scenarios that can happen. Either the immune system is finally able to kill off the Mycobacterium tuberculosis, and that's the end of the story, or the Mycobacteria remain viable. Even though they're walled off, they just remain dormant. This is known as latent TB. When the person's immune system gets compromised, like in HIV, the latent infection can then become reactivated and start to spread around. This is known as reactivated TB. For that reason, giving patients certain immunosuppressant drugs should be preceded by a TB test to make sure that the patient is free of TB. As the immune system has been previously exposed to TB, memory T cells quickly release cytokines trying to contain the spread, and this leads to more areas of caseating necrosis. This time, however, it tends to cavitate, which can lead to disseminated spread of bacteria. It can also spread through the lymphatics to other parts of the lungs and can lead to bronchopneumonia. Spread through the vascular system is also possible, which leads to infection of other tissues in the body. This is known as miliary TB. Nearly any organ system can be involved in it. It can lead to meningitis if it spreads to the CNS and can cause pericarditis if it spreads to the heart. Important clinical correlation to keep in mind is that if TB spreads to the spine, it can cause something called Pott's disease. Another association to keep in mind is that pulmonary TB is related to aspergilloma. Moving on to clinical signs and symptoms of TB. Primary TB is usually asymptomatic, but leads to a positive PBT test. It happens mainly in people who have an ineffective immune response, like kids and patients undergoing chemotherapy. TB has a triad of symptoms: fever, night sweats, and weight loss. In addition to that, patients can have cough with blood, this is known as hemoptysis, and pleuritic chest pain, which is chest pain while breathing. They also have fatigue and arthralgia. Hilar lymphadenopathy is also a very early sign of TB, which usually occurs in the first week of infection, and it takes months to years for it to resolve. Reactivated TB can also present with cough, weight loss, fatigue, fever, night sweats, and hemoptysis. Now, time for another flash quiz. What type of response causes the production of a Ghon focus? That's correct, Th1 response. Mycobacterium tuberculosis grows slowly. Because growth is so slow, cultures for clinical specimens must be held for 6 to 8 weeks before being recorded as negative. They need a special medium to grow called Lowenstein-Jensen medium. Diagnosis is usually made through the tuberculin skin test, also known as TST. It's done through a subcutaneous injection of purified protein derivative. The diagnosis is made on the basis of the diameter of the resulting induration. Quantiferon TB Gold test is a new test for TB, and it has a very high specificity and sensitivity, and thus is considered the gold standard test for latent TB. So for the diagnosis, after screening with either TST or quantiferon, if they come back as positive, we can proceed with a chest X-ray. If it has suggestive findings of TB, then the confirmatory test would be a sputum sample to stain for acid-fast bacilli. Active patients require a multi-drug regimen, which includes RIPE, which stands for rifampin, isoniazid, pyrazinamide, and ethambutol. Patients with latent TB can be given isoniazid as monotherapy. After we've discussed everything regarding TB, now we're going to talk about how we can prevent it. Better housing and nutrition can decrease your chances of getting TB. The infection spread can be reduced with prompt identification and adequate treatment of patients, and also with using masks and other respiratory isolation procedures, specifically among the medical personnel. Lastly, there is a vaccine for TB known as BCG vaccine. It's a live attenuated vaccine containing a strain of Mycobacterium bovis. It's used primarily in areas of the world where the incidence of the disease is high. However, it's not usually used in the United States because of its variable effectiveness, as it only induces partial resistance to the organism, and because the incidence of the disease is low there. Alright, to sum it up. Today we talked about TB. Remember the letter M. It has a cell wall made of mycolic acid, remember acid-fast. It infects macrophages, so it's intracellular, and it leads to granulomatous reaction. And finally, active TB is treated with multi-drug regimen, while latent TB is treated with isoniazid monotherapy. And that's it for TB. We hope you enjoyed the video. Please let us know what you think about the new flash quiz part, and what do you like or dislike about this video. Don't forget to like, share, and subscribe to receive our latest explanations. And as always, thanks for watching.